I am Dr. J.S. Arora, General Secretary, National Thalassemia Welfare Society and Federation of Indian Thalassemics. We all know thalassemia is a serious inherited blood disorder which requires lifelong repeated blood transfusions and costly medicines for survival. But the most important thing is we should know why this dreaded disease occurs. It comes only from parents to children. It is a genetic disorder. See, we have different genes which decide height, weight, color, complexion, anything. Eyes are blue, brown, black, or you can say the color is fair, darker, or hairs are curly. All these are by the genes. Genes are always in pairs. Here we talk of the pair of gene which forms blood. If that pair of gene is normal, we see the person is absolutely normal. If one of gene is abnormal, it is called thalassemia carrier. And if one is abnormal, it doesn't cause any problem. Just like if we have our right hand is weak, our left hand becomes stronger. That way you have seen in the Sachin Tendulkar making century with the left hand. So same way, if we have two kidneys, if one kidney is not functioning, no problem. When many times we come to know at the age of 40, 50 or 60 years, incidentally the person has one kidney. And when the kidney transplant is done, the both donor and the patient, they want one kidney. So same way, with one affected gene, it doesn't cause any problem. The problem arises only when husband and wife both are thalassemia carrier. Because whenever a patient is born, it takes one gene from one parent and other gene from other parent. If it takes both normal genes, child is absolutely normal, even better than parent. If it takes one normal, one abnormal gene, the child is like parents, thalassemia carrier, and do not require any treatment. If unluckily patient takes both abnormal genes, then the child is absolutely having thalassemia major, who will require lifelong repeated blood transfusion. So how to prevent it? But first of all, it must be known that this thalassemia is not a disease of few people. In India, 4% or say 5 crore Indians are thalassemia carrier. And the 10,000 to 15,000 new thalassemia major are born in our country. So to prevent this disease, it is the best way is every boy and girl should get oneself tested for thalassemia carrier status before marriage. If one is not a carrier, one can marry anyone, the child will never be affected. If one is a carrier, preferably don't marry a carrier, because if the other partner is not a carrier, then two genes will not transmit to the child will not be infected. And if at all you cannot get your tested your partner before marriage, no problem. You get yourself tested for thalassemia carrier status. If you are not carrier, no problem. After marriage, check your thalassemia carrier status of your partner. If both are not carrier, no problem. One is carrier, again no problem. Child will not get two affected gene. If both are carrier, then there is 25% chance of having a thalassemia major child in each pregnancy. And in that case, at around 12 weeks of pregnancy, or say 10 to 13 weeks of pregnancy, we can check whether the fetus is affected or not. If it is affected, it can be aborted, which is legal and ethical. And if it is normal or carrier, then one can continue the pregnancy. Here I like to mention a very famous celebrity of India, that is Amitabh Bachchan, who is also a thalassemia carrier. Since Jaya Bachchan is not a carrier, the children are not thalassemia major. So at a person like Amitabh Bachchan at 82 years of age, if the person like him is so resourceful, educated, and active, even much more than we people are there, if he can be carrier, why can't we? So my humble request to each one of you is everyone should get tested for thalassemia carrier status before pregnancy, and much better if it is done, you can say before marriage. And the latest is in early pregnancy or first trimester of pregnancy. So the third thing is, since these children survive on repeated blood transfusion, I'll request the public to donate blood every 3 to 4 months so that these children can live a near normal life. Thank you very much.